There's always
Nice.
change.
Yay, that's great news, Emily. You're very welcome. All right. Hi there, people at home. Hi there, people here. Good to be with you tonight. Interesting enough, I'm going to give I said I was going to say, why do we adjust babies? And I actually did a presentation for chiropractors only. Let's see, it was 2 years ago. And they came to our office here in Alpine, and I did a presentation on adjusting babies. So that actually is the PowerPoint that we're going to use tonight. Yes, this is me with the same glasses on, and that's one of my little granddaughters, little cutie there. She was obviously pretty new there. Now she's about 20 months old. So why check and adjust babies? So give you the very easy answer to that. This is our resident baby, and we're going to pretend the baby, it's probably about the right size. So baby is in mommy's tummy or uterus, and here she has to get out. So if they go vaginally, that's why the cranium is overlapping. It has a big fontanelle here in the middle and in the back, so that when it goes through the vaginal canal, it can go through as easily as possible. Still not easy, still very challenging to the head and particularly to the neck. And then if the healthcare provider, whether it's a midwife or a doula or a goodnight or a action on the neck, some pulling depending on what the presentation is, and doing that on a very, very weak neck that has had no reason to be strong at all, can definitely cause subluxation number 1, 2, etc. Now, if it's a particularly difficult birth, that's even more of the case, because then if the baby was breech, for example, babies that are breech have a 50% greater likelihood to have hip joint issues and a scoliosis in the spine. They also have been in the wrong position for that long, so there's going to be some other issues. So one of the things that's for another seminar, another workshop, is that we have a very natural way to help turn a baby. So when mom comes in, we work actually on her pelvis. Actually, you know what? We happen to have a resident female full spine right here. So we'll just show you what I'm talking about. So the SI joints are these huge joints here between the pelvis on the one side and the sacrum in the middle. So this is sacroiliac. The iliac are the what are called wings. So typically what we do using something called the Webster technique, on that side where let's just say it's on this right side, we'll work on that area to work on the area here to get the sacrum more aligned, and work over here, and we teach husbands, dads to do that as well. So we relax that, loosen that up, so then the ligament here that's attached from the sacrum to the uterus relaxes. And then, is this Sally, by the way? Is that the name? Yeah. So Sally, it's very nice to cooperate with us. You have to imagine a nice little burgeoning, here's the baby's inside here, kind of like that. And there's a ligament on the front here, the round ligament and the broad ligament that we work on right in here. And that we help to relax as well, so that if the baby is breech, it hopefully will relax and then turn to the right side, correct side going down. So even under the best of circumstances, birth is very traumatic for mom and traumatic for baby. So that's why we recommend getting a baby checked as soon as possible, as soon as the mom feels comfortable. We've had babies on the first day they were born, on day 1, day 2, week 1, 2, 3, etc. And the sooner that we can actually check the baby to see what's going on, the better off they're going to be. So this was for a chiropractor that wanted to have a lot of kids in their office. We equated having a lot of babies in the office kind of like a hurricane. So there's the eye of the storm, and then there's all kinds of stuff going on, crying, screaming, pooping, all that kind of stuff. I went to a pediatric seminar, and the person who was the presenter kept talking about, basically, I don't know, if kids come into your office, they cry, I don't really know what to tell you. And after the second time he said it, I raised my hand. I said, so I'm just curious, but do you have any kids? And he said, no. I said, well, You don't try to make kids cry, but kids actually, that's the way they communicate. So they're going to cry, and that's just part of the process. So why bring a baby to a chiropractor? Subluxation discussion, we're going to talk about the autonomic nervous system, the two parts of that are sympathetic and parasympathetic, and how to be extremely gentle with the baby. So subluxation is when a vertebra, I'm going to use Sally again, this is the big version, but when a vertebra gets misaligned, moves one way or the other, and it gets out of alignment, that's called a subluxation. So that can happen on a very big person, and it can definitely also happen on a little teeny person. So we look very gently for subluxations, misalignments. If they are there, we use about as much force as for me to hold this remote. We don't do any yanking, pulling, twisting. It's very gentle. A lot of what we do actually is called craniosacral. So cranial is the head, sacrum's down here. So very gentle on mommy or daddy's lap. And we're having the baby there, and we're just very gently working on those two areas that help to actually calm the nervous system down. That's the parasympathetic part of the nervous system, or the calm down part. Sympathetic's in between here. We do very gentle, easy, any kind of adjustments here. Basically about as much pressure as what I'm showing right now, which is just very, very easy. We're looking for where there are subluxations. On the neck, we usually have the baby like so. And we'll just use finger pressure and very light. If they have a tight side, which could be torticollis, which I think is one of the things we're going to talk about in a minute. There's a motion palpation while on mom or dad's lap. So we're actually feeling how well things do or don't move. And we come in here and we actually will sense where there is a misalignment or subluxation, and we'll just very gently work on that. We also, if there is torticollis, which means that the baby's head, instead of being straight, is to one side or the other, we'll just say it's this side. If it's this side, interesting enough, it's not the underside that's tight, it's the upside. So we actually teach mom and dad how to work on the tightened part of the neck there and gently encourage the neck to get more in the middle. So that's one of the very common things that we do to help a lot of children. Sometimes their heads are actually a little flat because they can only turn that way. So if you look at the baby like that and they can only turn their head that way, well, that's where the flat spot's going to be. So by encouraging the parents to help the baby's head turn both ways, and again, we don't force it like that. We just got to put a hand behind here gently and rotate it and stretch it, and then we do the same thing going the other way. So that will help the baby's neck and comfort level, and also help shape the cranium. So a lot of times we've been able to actually help moms and dads not have to use a helmet when there even was a flat spot, because we improved the movement. In fact, if you use a helmet without correcting the underlying problems of what's going on in the neck, and even sometimes the jaw and the cranium itself, then you might have a more rounded head, but you haven't taken care of some of the underlying challenges, which is not good. So we do the little motion palpation on the baby. These are just some of the things that we would check on a person, on a baby. We would look at testing the full spine. I do what's called muscle testing. So I have the mom or dad holding the baby, and we do something called AK testing. We've done another workshop on that, where we actually can sense what is in need and what isn't in need on the baby, using the mom or dad as a surrogate. We do measure the head, one side versus the other. Sometimes it's extremely obvious that there's a flat spot. And we then make a measurement of that and work on helping that to become more rounded. I had a grandson who was born average size head, but he got stuck in the birth canal. And so he had this big hematoma, which is a swelled up area. And at the time, my daughter was living in North Carolina. I was here in Utah. And she showed me a video of her son, and I tried not to react. She said, "It's okay, Dad. It looks terrible. I understand." And so I said, okay, I taught her a couple of things to do. I couldn't go out there for a month or two. And so I taught her a couple of things to do. And she said, yeah. The scary thing was the pediatrician that we went to said, well, don't worry about that, because if it's still there after a couple of years and it's calcified a little bit, we'll just shave it off. And my daughter said, I don't think we want you to shave my kid's head. So luckily I was able to go out there, and like I said, a month or two later, and help do some things to help get that swelling to go away. and now you'd have no idea that he ever had it because it actually went away within about a month's period of time. One of the things we do with babies is hold them upside down gently, and that actually helps to relax the body as well, stimulating that parasympathetic part of the nervous system. And usually babies really like it. Sometimes they don't. You don't want them going banana right or left. You want it just to kind of relax, and it helps them chill. So we do also check neck rotation when they come in. I already said that. We do a scan that shows what's going on temperature-wise in the spine, and that gives indications about whether there's pressure here in the spine, number one, and also if there's any issues from the stomach or organs in the inside the body that are causing referred messages of temperature difference here in the spine. And it's a very easy thing to do. It's just a little thing we roll up the spine, and it gives us a good indication. We do ask about the trauma history, if there was injury history, what the birth was like. Everybody, not everybody, some people think that C-section is the way to go. There's a bunch of reasons that you have to do that if it's an emergency C-section. If there's been a placental disruption or eruption, then they have to do that. The thing about, and some people say, well, they have a perfect head afterwards. Well, that may or may not be true. The doctor still, or the attending physician or midwife still has to bring the baby out. And the only way they can do that, there's no natural force from the contractions pushing it out the vagina. It has to be pulled out. And sometimes that can definitely damage the head and neck. I know some cases where they actually even use vacuum extraction because they can get a hold of them, and or forceps even in a C-section. So, and the one thing that the C-section you really miss is going through the vaginal canal. There's a major immune system boost. It's like going through this well-nourished area where all kinds of antibodies are, all kinds of things that are very beneficial to the child that a C-section baby doesn't get. And then we set them up to come back in. So here's an example of the baby with torticollis. So I don't know how well you can see that, but the baby's head is way off to the side. And like I said before, this is the side that the muscle's tight. So this is the side that has to be loosened up and relaxed, and so that baby can get back to more normal, turn his or her head more normally. That's a big deal. So that is that. So we try to be very, very natural with babies. I've always loved babies, even before I had some of my own. I do have 6 kids and now 14 grandkids, and I've always just been very comfortable with babies. They're a lot more fun than some crotchety old adults are, or teenage boys, for example. So we try to be very careful in explaining what we're going to do. We do a very gentle thing. We ask permission. The mom is always, or dad is almost always holding the baby. Occasionally we'll put the baby on their back on a little soft pillow we have to do some things on the front, on the abdomen, on like if they have reflux is something we do, or if they have constipation, we do something. But otherwise, they're being held by the mom or dad the whole time. If the baby needs a little break, or the parents do, we take a little break and we just chill and relax. So this is just kind of I do a homework sheet for parents. We do that here. And the basic things we usually give for homework are one side of the neck often is tighter than the other. So we'll have them do little trigger points on that side, work on the rotation I already talked about. Occasionally there's something going on with the jaw too that we'll teach the parents how to do something about that. A lot of kids come in that have reflux, and there's a very easy thing to do right underneath the rib cage, pulling down gently. It's the hiatal hernia area, and helping that to get away from that pretty weak sphincter between the stomach and the esophagus. You don't see many toddlers even, or elementary school, junior high, high school, college, and adult children having reflux because that sphincter is strong enough. You may have heartburn, but it's unlikely that you're actually going to let that come up. Whereas babies don't have that strong of a control. Their GI tract is called immature or leaky gut for the first 2 years of life. So doing something to help get pressure off of that can be really, really a big deal. I have tons of stories I could tell. I'll end with a story tonight on that. The other thing, if they're constipated, doing a little U-shape on the intestine, gentle massage can help. And if they're really not pooping enough, then you actually get in and you push down a little more firmly on that descending part of the large intestine or the colon, and that has worked on people of all ages. Pretty amazing. I've had many babies with that, many people pretty much of all ages. We have senior citizens that we work on and do that as well. So that's what we do there. The poop shoot we talked about, cranial work, we do a little something there. One of the things that we try to do at our office is to make it fun. So like what we did, one of our assistants here, Lainey, thought of about having little footsteps in the office. And I thought it looked cute, but I didn't think anything about it. But the kids thought it was the greatest thing. In fact, we got green ones right now because it's almost St. Patrick's Day. And the kids, we try to have things that are fun. We have coloring pages. We have relatively healthy snacks, raisins and pretzels. Pre-COVID, we always used to have apples, and now we don't have those, but maybe we'll get them again. Anyway, we try to make it fun. We do decorative things. We have weeks that they wear a different color and they get a prize, like a necklace or a sticker or a pencil or something like that. So we try to make this a really fun office. My parting words about babies in particular would be, pediatric dentists have done a really good job about encouraging people to bring their children in even without symptoms. You don't have to have a symptom to go see pediatric dentists. They won't say, oh, no toothache, no problems. They can't come in. They'll say, oh, great, let's check them out. We do have a lot of babies that come in that do have issues like colic and constipation. They're not sleeping well. They're uncomfortable, all kinds of things like that. But even a baby that has no symptoms, no apparent symptoms, we're happy to check them out. Moms that come in during their pregnancy, we check the baby out at no charge the first time, just to encourage them to get checked. But we highly encourage getting babies checked, because if you start off life by being well adjusted and having no pressure on the nervous system, you have a much greater likelihood of having a healthy baby and a healthy child. So I think that is what we did. Yep, that's it. So there we go. Thank you. Feel free to ask additional questions. Talk to you later.